Kathleen McDonnell, and I work as a specialist registrar in public health medicine in Galway. So you're very welcome, Dr. MacDonncha. Thanks a million for joining us today.
Thanks yourself, Kathleen. Happy to be here.
Great. So I'm sure many of the students and staff have seen the UniCov logo, the signage, the notifications on social media pages and all over campus over the past couple of months. So today we're going to talk through some questions that students and staff have sent into us in relation to this project, so that we can answer the questions that they have posed and provide them with more insight and information in relation to the project. So just to start off, we'll just ask some questions in relation to the study itself. So Dr. MacDonncha, in your own words, what is the UniCov project?
Well, basically the UniCov project, it's a research study that's looking to develop kind of rapid testing and kind of monitoring systems to ensure a safe and sustainable return to face-to-face activity on campus for both students and staff. And it's a project that will be running across 4 institutions, higher education institutions in the country. So ourselves here in UI Galway, Trinity College Dublin, University College Dublin, and University College Cork as well.
Great. And that's great. It sounds like a really worthwhile project. And I suppose before we move on to the next question, I would just like to say to any of our viewers here, and we have a number of people joining, which is great. If anybody has any questions that they would like to ask Dr. MacDonncha in relation to the UniCov project, you can place them in the comment section below the screen, and we can get to them at the end. So moving on to the next question, why was the UniCov project started?
Well, I guess as students and staff, we were most campuses were essentially closed from normal activities since March of 2020, at the beginning of the pandemic. There was some, in some institutions, maybe partial kind of return or limited return to campus, maybe for research staff and limited numbers of students who were doing maybe practical or lab work in semester 1 of last year. But then obviously with the wave that came in Christmas and January, that everything returned to 100% online teaching and third level education then for the second semester. So there's been a long period whereby students haven't been on campus. And even with the limited number of, the limited amount of teaching that happened and on-campus activity that was there in semester 1 of last year, I know from our own perspective here and other health units across the third level institutions that there were outbreaks still occurring in semester 1, even with the limited on-campus teaching that occurred. And then there were even greater outbreaks here in Galway, we'll say in February and March of this year, when it was 100% online teaching. So I guess the key thing is that when COVID is around, there's always a risk, and that risk is there both on and off campus. So I guess it's a case of when we're trying to bring students and staff back on campus to teaching and learning environments, that we want to try and make those spaces as safe as possible for all involved, while the pandemic is still in play and while COVID is still in play in the wider community, because getting involved in this research study is going to, as I say, it's going to make those settings safer now for those who are participating and undergoing the tests as part of the research project, but also it's going to assist into the future because it'll inform the development of kind of early warning systems that will help the better kind of management of any future outbreaks, and also hopefully prevent kind of future large outbreaks as well in the coming months and years.
Great. So it sounds like a very worthwhile study in relation to providing a safer campus in the era of COVID-19 and the pandemic, and a very proactive initiative in collaboration with public health and with the university. I understand that NUIG was one of the first universities to start this project and to implement it on its campus, which is implemented for a number of weeks now. Are there other universities in Ireland involved with the study?
Yeah, so the University College Cork, University College Dublin and Trinity College Dublin are all also involved. As you mentioned, we here in NUI Galway would have started initially back in late July with some testing. So there are participants already engaged in the project here. Predominantly probably staff and kind of postgrad students who would have been present over the summer months. but we'll be very hopeful that we can get an even greater engagement now that we return to the formal academic year in the coming weeks, and that we see a huge increase in staff and students returning to the campus environment.
Great, and I'm sure that will be music to a lot of staff and students' ears that they want to get back to their lovely campus there in NUIG. So hopefully this will facilitate it going forward into the next academic year. So who was involved with starting this project?
So this project is it's being funded by Science Foundation Ireland, and it is collaborating with the 4 academic institutions. Also, it's being backed and supported by the Department of Higher and Further Education, the Department of Health, and the HSE. The lead investigator for the project is Dr. Breda Smith, from the Director of Public Health here in HSE West, and she has fellow investigators as well across all of the academic institutions and within the HSE as well.
Great. Has this started already? Has the project started in NUIG already?
Yeah, so it has. It's gone live, as I say. The website and everything went live there. I think it was late July, early August, and so we have a number of weeks done already with participants being involved, collecting their packs, undertaking their tests, and with the data from those tests being monitored. So yep, it's up and running and ready for anyone to join. They can join straight away if they're interested.
Great. That's great information in relation to the project itself, who's involved and where it's occurring throughout the country. Now I'd like to move on to some questions about these questions would be more for the students and staff who might be interested in getting involved in the project, and what they might anticipate or expect, or what it might look like for them if they decide to become a participant in this project, or as we call it, a research study. So who can get involved with the study?
So any registered student of any of the 4 institutions or any staff member working within any of the 4 institutions can get involved in the study.
Okay, great. If one decides to become a participant in the study, what would this involve? Like, what would they have to do, or what would it involve for them?
So the study and the project itself, what that actually involves is that when someone registers and becomes a participant, they're automatically randomly allocated to one of two groups. So one of these groups is going to be involved for a period of 8 consecutive weeks, while if you're allocated to one of the other groups, you'll only be involved for a 2-week period at a time. Within each of those groups, whether you're there for the full 8 weeks or whether you're just in for 2 weeks at a time, those are all the testing is run across a 2-week period. So any test kit that a participant gets, it covers them for 2 weeks, and that'll involve them undertaking self-testing using a rapid antigen test, which is a nasal swab, twice a week for the 4 weeks, and that's done on a Monday and a Friday. They also, at the same time as taking their nasal swab, or just after they've taken their nasal swab, they also provide a saliva sample. So all these collecting kits and test kits have little vials for collecting saliva samples. So you do a nasal test for your rapid antigen test, which gives you a result within a half an hour, and you also collect a saliva sample that you put in a sealed bag. The students, or the participants, will say, students or staff, do this for the 2 weeks. There's set kind of a drop-off time, we'll say, for the saliva samples need to be dropped off at specified collection points before 11 o'clock on Mondays and Thursdays. It's important